Hi, I'm Dr. Monica Bonakdar. I'd like to welcome you to Bonakdar Aesthetics, the premier non-surgical aesthetic practice in Southern California. I've developed a precise rejuvenation method called 5R Rejuvenation Method for customizing treatments that work synergistically together for stunning natural results. The first R is relax, reflate, resurface, redrape. The fifth R is retain. We will guide you through your aesthetic journey, delivering world-class results and remarkable patient care. We simply settle for nothing short of superior, paying fanatical attention to every detail of your care. Hello and welcome to this live educational webinar called Subtle Tweaks and Fabulous Results. I am your host, Dr. Monica Bonakdar. I'm so excited to be here. My team and I have worked very hard putting together 3 case studies to present to you. In each case study, you'll hear from the patient before the treatment. I will do an assessment on their before picture. Then you'll watch my injections. I will show you the after photo and discuss the changes, and then you'll hear from the patient again. As you watch, I want you to identify parts of your face that you want treated. And also you'll learn about my technique for injections and my results. Throughout this webinar, there will be 3 giveaways valued at $1,500. And at the end, I will have webinar exclusive offers, including an opportunity to get 4 Monbon clinical skincare products valued at $340 for free. Then we'll have our question and answer session. This is an interactive webinar, and so I'm going to do some housekeeping and tell you about the communication tools at your disposal. If you're on a desktop or a laptop, look on the right lower corner of your screen and find the chat box and the poll box. During the case presentations, I would like for you to go in the poll window and answer the question being asked. I'd like to find out more about you. And after each case presentation, I will remind you to go to the chat box. I will ask you a question, so pay very close attention to everything coming out of my mouth, as the question is, the answer to the question is right here, and you can answer in the chat box. The first person to answer will get the giveaway. You can also leave your questions for me for the end of the presentation, and I will have a question and answer session and answer all your questions. Okay, a little bit about me before we get started. I've been practicing aesthetic medicine for over 20 years. I'm board certified by the American Board of Laser Surgery. I am an Allergan Medical Institute faculty and teach other physicians and nurses how to do injectables. You saw my Newport Beach video or Newport Beach office in the video. I have 2 other practices, one in the desert in Rancho Mirage and one in the Inland Empire in Corona. And my entire practice is focused on non-surgical aesthetic treatments of the face and body. Last year, I injected 65,000 units of Botox. That's a lot of Botox. An average face needs about 60 units. And I did 1,250 syringes of fillers. All right, so I think we're ready for our first case. Hang on there, and we're going to hear from our patient.
My name's Michelle, and I'm super excited to be here today. Here I am, almost 50 years old, and I found myself in the need of a serious glow up. And so I've heard Dr. B does great work, and so I'm here to help address some of the issues that I've seen as I've gotten older around my eyes and my temples, and potentially a little bit in other areas too.
When you have a consultation with me, my medical assistants will take photos before and after your treatment. I have many before and after photos of my work on my website and on my Instagram. This is Michelle's before photo. When I look at a face on photos or in person, I look systematically and identify the aging changes. For Michelle, her forehead looks beautiful while her temples are empty. Her lower lids laterally, as well as her cheeks, have flattened, giving her a tired look. Her left cheek is lower than her right one. Her lips are beautiful, but she wants them enhanced. She also has marionette lines on the left side. On the side view, you really can see the soft tissue loss in the lateral lower lid area and the unevenness of the marionette area. Lid cheek junction, lips, cheeks, marionette. This part of the video has been sped up. I always start my injection treatments by making my pattern. Temples that are too concave make you look sickly and old. In healthy, youthful individuals, the temples have just a slight concavity to them. The instrument you see in my assistant's hand is a vein finder, which helps me avoid bruises. I use my precision microdroplet delivery technique in the lower lids by transferring the filler to a series of microsyringes with tiny needles. This gives me a lot more precision on my injections, and it's more comfortable for the patient. Now I will start the mid-face and lower face. I use my precision microdroplet delivery technique for the lips as well. Desired lip results vary among my patients. Some patients want natural looking under the radar lip results, others want a more moderate look, and some want a dramatic look.
Oh my gosh, wow.
What do you see?
I feel like the face looks more youthful overall. Like the filling in here really has reduced the longevity feeling that my the long face that I feel like I was getting.
Yeah.
And I just feel like I got the glow up that I came for.
Good.
It's beautiful.
Yeah, we did temples, around the eyes, cheeks, the marionette lines. Here's Michelle's before and after photos side by side. The first thing I want you to notice is that she doesn't look overdone, unnatural, or bizarre. Almost every patient worries about unnatural results and verbalizes this fear during their consultation with me. Look at her temples. Do you see how a small tweak has such a fabulous improvement? Now look at her lateral lower lid area and cheeks. The tired look has been replaced with a healthy, vibrant look. As we age, the chin becomes its own isolated island, and we form marionette lines and smile lines. By addressing these areas, Michelle's entire lower face looks connected and the harsh lines are gone. The side view also shows the difference in the temples, lower lids, cheeks, lips, and marionette chin areas. Let's see what Michelle says about her results.
My name's Michelle, and I'm here for my 2-week post glow up, and I have to say that I am absolutely thrilled with the results. I really understand the importance of going to a doctor versus going to a med spa, and I'm happy to say that I've found my permanent home here with Dr. B. My recovery was great. Within a week, you could see that everything was settling in perfectly, and I can't wait to come back for my follow-up visit. I liked it so much that I decided to do Botox here just to finish off my complete look.
Okay, so that was our first case. We also had a poll question and didn't get any participation. So if you're on the poll side, please go to the chat side. There is a hydrofacial treatment giveaway that I'm going to ask for you to answer the question that I'm going to announce, and whoever answers the question gets the hydrofacial. We decided instead of just us picking a name out of the bag and raffling things, that we are going to see who's paying attention. So, are you ready? Send me a cue. Say yes in the chat. Oh, I see some thumbs up. Okay. The first question is, how long have I been practicing aesthetic medicine? All right. Some people are listening. I love it. Susan Finkbeiner is our first one. Thank you all for responding. Okay, Susan, you win a hydrofacial. It's valued at $200. I have two lovely estheticians. One of them is Liz, who is helping me with this webinar, and the other one is Lori. I absolutely love both of them, and we hope to see you in the office soon. Hopefully when you filled out your registration form, you gave us all your correct info, and we will contact you so that we can make your appointment. Okay, so how did you like the first case study? We did a model calling, and then we chose our models, and I really wanted the models to be representative of the kinds of patients that I see. Everyone at the practice pretty much worries about the same things. They don't want to look unnatural. They are afraid of pain. They're afraid of bruising. So this was a very good example. And thank you, Michelle, our model. I absolutely loved her. She was brand new to me. Okay, so the next case study is very special, and we're ready to get going.
Hi, I'm Jennifer Curtin, and I have been to Dr. B before. I came to her because I used to go to someone else in Newport Beach. Results were fine, but I thought we could have achieved better results, and we have. I want to get it through the cheeks, kind of tighten up the jaw a little bit, and kind of through here to kind of elevate the results that I've already achieved with Dr. B. And I am 51 years old. I'm so excited and crazy anticipation for the results that I will achieve, because I trust Dr. B and I know that I've already gotten good results, so I feel like this is going to be great.
Jennifer is a beautiful gal who's taken really good care of herself and doesn't look her age. She started coming to me 10 months prior to this treatment, and I've optimized and lifted her cheeks already. In this treatment, I will address her lower lid soft tissue loss so that she won't look so tired. I will also contour her jawline to look more youthful. Her side profile shows the emptiness in her lower lid area. A youthful jaw has a sharp angle like the letter L. With aging, our jaw angle melts away and the L becomes more like an I, much like you see on Jennifer. I also want to address the frowny, downturned lip corners. I do tons of lower lid filler injections and have many before and after photos of this area on my website. I always have an assistant with a vein finder helping me to minimize bruising. Filler injection in the lower lid area is an expert level injection, not to be trusted to just any injector. I don't know if you've heard, but just recently a new filler called Juvederm Volux has become FDA approved for jaw contouring. As an Allergan Medical Institute faculty, I am one of the first physicians to get trained and receive this brand new filler. The gold instrument you see is a microvibrator for pain management. Vibration sensation gets to the brain faster than pain sensation, fooling the brain.
Right?
Look at this, and this, and then I went all the way around the eyes. So you're connected.
Here is Jennifer's before and after photo. She looks amazing and has gone from subtle tweaks to fabulous results. The before photo displayed was taken on her first treatment with me 10 months ago to show the progression of her cheek lifting. Her eyes look youthful and not tired anymore. Her lower face looks contoured and lifted. Her side view also showcases her improvements, including her lower lids, her cheeks, and her jawline.
Hi, my name is Jennifer Curtin. I'm 51. I'm here for my 2-week results checkup. So just kind of wanted to talk about what I'm pleased with my results. I love the more fullness in my cheek and the more refined jaw that I have. And you know, I've heard time and time again how people go to a med spa. I just absolutely would never. I don't think you should get a discount on your face. And the results are far better when you go to a doctor like Dr. B. And the recovery was easy. I mean, I bruise easily, and I think I maybe had one, you know, and I'm historically, because I have light skin, but it was easy, painless. There was no recovery. I already come here for my facials, so it just seemed like a natural progression to come here for my fillers and facial needs. So I definitely will be back. This is my spot. I wouldn't recommend going anywhere else. And I used to go to a different plastic surgeon in Newport.
Okay, so that was our second case with Jennifer, and we are ready for our second giveaway. We're going to double what our last giveaway was. This one is valued at over $400. It's a basket of Better skincare products, which is one of the brands that I carry in the office, and amazing products. I use their sunscreen. And all right, so the question that I am going to ask, you will have to answer in the chat box. And Susan, who won, cannot participate. Sorry. All other Susans, go for it. Okay, so how many syringes of fillers did I say I injected last year? Okay, I think I've stumped some of you. Oh wow, someone says 65,000. Okay, Paula, that was the units of Botox. 65,000 units of Botox, and that's over 1,000 patients, and 1,250 syringes of fillers in the 3 practices. And I'm looking to the side because I don't know who the winner is. I think it's Susan. Pardon me if I butcher your name, Cerise or Carice. So another Susan. Oh my gosh, you guys are taking over the world. Okay, I have one more case presentation. This is a brand new patient to me who had never seen, and let's go for it. And looking to now my right for my assistant to start the video of case.
Hi, my name is Jamie, and I'm really excited to see Dr. B today. I'm just feeling like I need a little help around my eyes and possibly right in this area. I just want to look refreshed. I am really excited to see what Dr. B has in store for me today and to see my results.
Jamie is new to my practice. She's 58 years old and has these beautiful high cheekbones. The 2 parts that she pointed out are her lower lid area and around her mouth. And these are exactly what I'd like to treat as well. On the side view, you can see the lower lid hollows as well as the wrinkling around the mouth. So I've done my refreshed eye signature treatment for all 3 of our models. This area starts aging when we're in our 30s. Correction of this area really makes a big difference, transforming a face from looking tired to looking refreshed. Again, this is an expert level injection area, not to be trusted to any injector. The 3 hallmarks of facial aging include sinking, sagging, and wrinkling. Wrinkling aging changes are common in the lower part of the face and around the mouth. For Jamie, I'm performing my Chinmergency signature treatment to get rid of these unwanted wrinkles. Many patients who want their lip lines disguised are not interested in larger lips, whereas others do want a slight lip enhancement. Almost everyone worries about unnatural results. Poor results in this area have to do with the skills of the injector and the product chosen. There are premium fillers like Juvederm, Volbella, and Volure that give very natural results when used correctly. Here I'm disguising the static wrinkles or etched in lines between the brows that don't respond to Botox cosmetic.
Oh, wow.
What do you see?
It looks great. I look refreshed.
Yes, you do. I did your eyes, the filler here,
Okay.
all of this, a little bit on the upper lip, on the outside, and then a little bit on the lower lip.
And a little more definition.
Yes, your chin is not an island, it's connected to the rest of your jaw.
Mm-hmm.
Yay!
It looks great.
Wonderful.
Thank
Here is Jamie's before and after photos. She looks exactly like herself, just not tired and not wrinkled. Her under eye hollows are gone. Her chin is better connected to the rest of her face. The side view shows the improvement in the lower face and the jowls. I'd like to treat Jamie's jaw contour on her next visit. This will further lift and disguise the jowling. I often plan the next visit before my patient leaves. Aging is ongoing. My philosophy is to do periodic, subtle tweaks, first starting with reversing aging changes and then transitioning to making you look ageless and forever beautiful.
Hi, I'm Jamie, and I'm here for my 2-week checkup after my injections. And I have to say that I am just thrilled with the results from Dr. B. And I feel so much more comfortable with a doctor doing my injections than I do at a med spa. My recovery was pretty amazing, which I'm really happy about, and I can't wait to come back.
Okay, so that was our third case, and someone earlier had asked, can we see a model with more wrinkles? Jamie had a lot of wrinkles around her chin, so hopefully you saw my road work of how I get rid of wrinkles. We are doubling our last giveaway, and this third giveaway is for a Botox treatment, and it is for about $900 of value. That's about 70 units. And my question for you is, can you tell me what are the 3 hallmarks of aging? Sinking, sagging, and wrinkling. Paula, good job. Oh my goodness. You guys are a great bunch.
Okay, so the first question is, what is best for eliminating jowls?
Okay, so yes, jowls are a huge problem, and think of it as all 3 parts of the face, the upper, middle, and lower, are connected. So whatever happens in the upper and the middle face affect the lower face. And so a lot of times when jowls are formed, by just addressing the jowls, you are widening the lower part of the face. But if we address the temples and the cheeks and lift those areas to their pre-aging position, then we're just addressing the soft tissue loss in the gels. So we discussed the 5 R's in my video, and I have technologies to address shrinking and tightening, but I do a lot of that also with fillers.
The next question is, what if I want the lines on the side of my nose?
What if I want the lines on the side of my nose? What do you want with them? You want them gone, or you want them to stay? I'm confused. You're probably talking about smile lines, and those are easy. I get rid of those with fillers.
How often do you recommend touch-ups?
So when I first do an assessment, I will do a full assessment, upper face, middle face, lower face. Some patients opt to correct everything at the same time, and so that their downtime and healing is all at the same time, and others will break it up. After we do our major corrective work, I usually see my patients every 3 to 4 months for their Botox treatment. At that time, I always reassess the face. I like reassessing your face every 6 months. However, we may not touch your face depending on the kinds of fillers we use, how long lasting they are, how much you're aging, how fast you're aging. And so most of my patients, I maybe touch them once or twice a year as their maintenance. The great thing to know is that, aging isn't uniform throughout your life. It kind of accelerates. And one day you look in the mirror and you're like, oh my God, I have aged overnight. And I hear this over and over. And the younger Monica was like, what? You haven't aged overnight. You've been aging. You just haven't noticed it. And now I totally get it, because there's been times where I've looked in the mirror and it's like, oh yeah, I'm aging overnight. And so depending on where you are in your trajectory and what you've done to bring back your looks and distance yourself from that chronological age, that's how we determine how much product you need to get to your desired outcome, and then how often I need to touch you. But aging is ongoing, so I really think that for the person who doesn't go to a different dentist or doesn't wear a different brand of clothing or shoes and wants to stay with the brands and the people that they've gotten to know, those are the people that feel comfortable in my practice and come to me periodically for their tweakments or their subtle treatments. Okay, what's our next question?
How long does it last?
All right, so I primarily use the Allergan family of fillers. There are many in this grouping, and the fillers are from 1 year duration all the way to 2 years duration. So it really depends on the area that we do and the filler that we do and the amounts that are used. So again, we go back to what your desired goals are, and usually, as I said, I'm touching my patients once or twice a year.
What is the downtime?
Downtime. So as I said in the videos, there are 3 fears that most every patient that walks in has: fear of looking unnatural, fear of bruising, and fear of pain. And so fear of bruising is what you're asking about, and that downtime, we do everything in our power to make sure that you don't bruise, including using a vein finder. So I don't do my injections on my own. I have an assistant, and my assistant is holding a vein finder, which probably has about $100 worth of technology, but it's a $6,500 piece of device pre-pandemic. Who knows? Maybe it's even more expensive now. But with this, I can see 9 millimeters down below your skin and avoid vessels. It's not 100%, but I do very good. That's my commitment to you. Your commitment is not to use anything that thins out your blood and makes you bruising prone prior to your treatment, including alcohol, vitamin E, many of the supplements, and herbs, and also NSAIDs, such as Motrin. So most of the time we don't get a bad bruise, and little bruises go away very quickly. Okay, next question.
When are you open?
When am I open? Okay, so between 3 offices, my schedule is as follows. I am in the Newport Beach office on Monday, Wednesday, Friday. We take our last patient at, correct me if I'm wrong, 4 o'clock? 4:30, 4 o'clock. And I am in Rancho Mirage on Tuesdays and Corona on Thursdays.
May I ask if they have any more questions?
All right, I think we've come to the end of our webinar. If there are any last minute questions, I would love to answer them. Otherwise, I want to remind you that in order to sign up for the webinar exclusive offers, you have until Monday, August 29th at 5 o'clock. We're in the office now, so I would say just send us an email, text, or chat that you want an appointment and you want to come in. I'm reading some of the chats, and Kathleen Hogan says that Doctor, you look so beautiful. Well, thank you. That was one of my buddies at the Women's President's Organization, which I no longer attend. I got a tad bit busy with my practices, but great group of women entrepreneurs. Okay, thank you, everyone.